this is Inside Cardiology. Today we have a discussion about a most fascinating paper just published online in the European Heart Journal. I'm discussing this with the first author, Florian Wenzel here. Welcome, Florian.
Thanks for having me.
So it's about the microbiome, and as you may know, we have more bacteria in our body than we have cells that make up our body. It's on the skin, it's in the mouth, but it's mainly also in the belly. And there they digest what we ingest, and they eat what we swallow. And when they get all these goodies that we swallow, they digest it into metabolites, and some of these metabolites, particularly if they're small molecules, they're taken up into the circulation and they can affect all our organs. And there are of course bad guys and good guys in this regard. Short chain fatty acids are protective, while trimethylamine, that's oxidized in the liver to TMAO, is a bad guy, as is trimethyllysine. But now we have a new marker, and that is a histidine product that bacteria produce. It's called ImP. So Florian, what is ImP?
Right, you've already mentioned it. The small molecules and microbiota metabolites are back on the map. Imidazole Proprionate, or ImP, is a metabolic product of the natural histidine metabolism. It has different levels in different people. It is believed to be particularly determined by the microbiota composition, and is fairly steady over time.
So you need the type of bacteria that produce it. Everybody eats histidine, and it's in many food parts included, but you need the specific bacteria that produce it, don't you?
Absolutely, yeah.
All right, so we measured this now in thousands of patients. What patients did we look at?
Right, so we set out to do a observational study in patients with coronary artery disease, including both acute coronary syndrome patients as well as chronic coronary syndrome patients. Both groups of patients are, per definition, a high-risk cardiovascular population. We included cohorts from Switzerland, from Germany, and in case of CCS only from Germany. We also did external validation across these different cohorts, and measured samples from patients at presentation in close collaboration with a group from Gothenburg led by Frederick Beckett, who are specialized in microbiota research and have published hugely on this particular metabolite as well as on others.
And so what did we find? We mainly looked at the prediction of this very marker, didn't we? So how good was it?
Right, yeah. So you've also already mentioned our study was very timely because it occurred a couple of weeks after the mechanism was elucidated in two milestone publications, one in ATVB and another one shortly after in Nature. And these papers showed that ImP is not only a predictor of risk, but also a causal agent.
For atherosclerosis.
For atherosclerosis.
And also involved in diabetes. Huh?
Yes. It is pro-diabetic, and it is pro-atherogenic. And it's particularly interesting that it drives atherosclerosis in an LDL-independent manner.
So it's a novel risk factor.
Yes, absolutely. And we translated this into the clinical setting. And in comparison to many established risk factors, it ranks among the most important predictive factors in terms of major adverse cardiovascular events.
So it's a new risk factor, it's very important, it's very powerful, and maybe it's a therapeutic target. What do you think?
Yes, it might very well be. So I think that immunomodulatory therapies are on the horizon. Also in the Nature paper I mentioned, the authors elegantly demonstrated that they were able to modulate IMP-driven effects in mice, and there are different therapeutic targets possible, I think, either inhibiting its production or its
like the enzyme in the bacteria.
Yes.
And the beauty would be that it doesn't have to be absorbed. It just has to work in the microbiome itself. Yes. So exciting new future drugs possibly, but at the moment certainly a very important novel cardiovascular risk factor. So besides the lipids, diabetes, and blood pressure, we soon will have gastrointestinal products from our bacteria as new risk factors and potential therapeutic targets. And at the end of this short video, you will see the paper published online as a fast track during the annual Congress of the European Society of Cardiology in Madrid. Enjoy reading.